Hi and welcome to another video from the CTAD Clinic. My name is Dr. Mike Lloyd and I'm the Clinic Director. So what I'm going to be looking at in the video today is a part 2 about integration, which is a key aspect of the treatment goals for dissociative identity disorder or other specified dissociative disorders. So these are the key conditions that we will consider integration to be an important part of the way that we understand and work towards therapy. So what I'm going to do in this video is look a little bit more at the conceptualization of this, not about the sort of the practical how to actually go about and achieve integration, but just what is it that we actually mean by integration and why is this concept so important. It's a key part of the phase treatment model of work for DID and OSDD in terms of stabilization, trauma exploration and integration are the 3 phases of treatment that are commonly used within the model of structural dissociation, which is what I think the majority of clinicians working in this field really adopt as the key way of being able to understand the framework of dissociation. So in the video I'm going to really look at the concepts of integration and just understand why this stuff is really important to us and why it's really necessary to understand what we mean by these terms so we don't get them confused with other things which can be very distressing for people if this is done poorly. So to begin with, thinking about the concept of integration, sort of looking at the International Society for the Study of Trauma and Dissociation, or ISSTD, their treatment guidelines in 2011. We are due some updates, but the 2011 model really understands integration within this sort of framework. So think of it along the lines of integration is a thing that has happened to a person during their developmental process. So that's normal functioning, right? We all integrate all aspects of our functioning, and if something goes wrong in our development, that integration process does not really work. So here's how it's defined within the guidelines. It's a partial or complete disruption of the normal integration of a person's psychological functioning. So dissociation can unexpectedly disrupt, alter or intrude upon a person's consciousness and experience of body, world, self, mind, agency, intentionality, thinking, believing, knowing, recognizing, remembering, feeling, wanting, speaking, acting, seeing, hearing, smelling, tasting, touching, and so on. So you can see that what we're thinking is it's pretty much everything. So if traumatic events take place really during childhood, this is what we're looking at. So whatever the type of traumatic event might be, is it disrupts the integration of the normal functioning of all of these facilities, capabilities and abilities and experiences and perceptions of a person, of that child, of that individual. So we use integration really along the lines of thinking about what has happened is a lack of integration during the developmental process of the self. So this sense of self is core at the heart of this. Without integration is we struggle to have a complete sense of self because our experiences are so sort of messed up and they're located in all sorts of different places as a result of the trauma, and they are not integrated. So when we think of this integration or lack of integration in terms of the model of structural dissociation, what we're not thinking is that there's been this completely normal or ordinary or complete personality that is somehow shattered and fragmented into loads of different pieces. So structural dissociation doesn't look at the individual as, say, a vase that is dropped on the floor and shattered and somehow needs to be put back together again, and that would be the process of integration. That's not what we're thinking. What we're saying is that the actual development of the self has not been integrated fully. So there's never really a vase to speak of. So there's no real sort of fragmentation of that. The growth of the personality is done in this fragmented way. So it's like the vase is more like an object that has grown in many, many different directions and doesn't really look or function as a vase as we would ordinarily see it. And this is why we think of it much more as a childhood thing, because that's when the brain is developing. So if the normal brain develops under normal processes without a great deal of trauma, then it grows into a unified sense of self. If these traumatic experiences are consistent and they are complex and they go on and they are often revolving around caregiver interaction type traumas, then the sense of self is grown in a way which is not integrated. So those early developmental periods are critical, right? So if the person has gone through their developmental phase is absolutely fine, and then events take place later in life, we don't see the development of the unintegrated self. We see dissociation that may take place as a result of trauma that takes place in late adolescence and adulthood, but what we don't see is this growth of the self as a non-integrated, non-unified personality or set of identity. It grows in a very different way because of the nature of the trauma that has taken place during the process of the emerging, developing brain. So integration is a function of normal behavior or normal development that takes place during the growth of the brain in childhood, and it doesn't become a fragmented thing that can break later on in adult life. So I hope that's fairly clear. It's probably not, actually. It's really quite complicated, but the way of being able to understand this is that we work with integration because of a lack of integration in the first place. That's really the basis of this. Therefore, integration becomes the goal of treatment. So within the structural dissociation model, what we're working on is thinking about how to integrate the sense of self. So here's a useful definition for integration in terms of the treatment goals for what we're working on when we're actually applying therapy to this. Integration is a broad, longitudinal process referring to all work on dissociated mental processes throughout treatment. So think about the list of things, the list of mental processes, which is a really long list. If these are generally not integrated, the goal of treatment is to integrate these mental processes, to bring them together so that there's a cohesive whole about the way in which the brain is actually approaching everything in the outside world, whether it's to do with the environment or to do with relational processes with people. It's done and worked in an integrated way. And this is different from fusion. I think this is the key thing that I want to come to, I want to finish with on this video, is that integration and fusion are different concepts. They can get mixed up. And sometimes when therapists talk about we need to work towards integration, people that are having therapy can get really stressed or unhappy about this or fearful about this because they believe what that means is that all the internal parts within DID or OSDD are going to be lost, brought in, and somehow then they're going to disappear. That's not what integration is. That's much more what fusion is. So here's a definition of fusion. Fusion refers to a point in time where two or more alternate identities experience themselves as joining together with a complete loss of subjective separateness. So fusion there is two or more of the alters, parts, others, whatever, coming together and losing that sense of separateness. So there is a joining together. So the fusion is those bringing together and there's an absence of separateness. So there is still integration going on, but it's done within the concept of fusion rather than just sort of a mental process. It's more focused on the identities or others or alters within the system of DID and OSDD. And then we have final fusion, which can be defined as being the point in time when the person's sense of self shifts from that of having multiple identities to that of being a unified self. So according to the ISST guidelines, which is where these quotations are taken from, final fusion is that point when there are no other identities. It is a unified self. So the person is essentially completely integrated with mental process and completely integrated with parts. But that second process would be that final fusion. It is a bringing together. So it's not just about a collaborative way of looking at things. It's actually bringing things together as if there is only one left. That is a goal of treatment for some people, but not for everybody. And it's really important to be clear and make sure and agree in therapy that this is a flexible process. That choice of whether just to go for integration or just to go for final fusion is something that can be done flexibly, and that goal, that desired outcome, can change over the course of treatment. It's often what people want to start with, but often what people don't want to end with. It's a really interesting process in therapy, and the therapist should work with the person that they're seeing, help them understand all the ramifications of this, develop a sense of choice of the person and within the entire system, because it has to be a signed up, consented process for this to take place, and to allow people to make that choice based on all the levels of information that they might need to make that choice, and to be able to change their mind if they want to. Okay, so hopefully that's clear. This is quite it feels like it's a simple process that gets made very complicated. So integration is useful within therapy because it relies upon there being an unintegrated self, which is what we see in DID and OSDD. So integration is about bringing together all the mental processes to give that person a unified sense of self, but they may still have parts and other identities present within the system, or they may adopt final fusion, which is the integration of mental process and the bringing together all the parts, so there is a unified person at the end rather than just a sense of all these processes working collaboratively. So I'm going to do a little bit more on integration because we're going to think a bit more about that. There's some more work to do on this. So hopefully this is at least a sort of a good starting point and a way of being able to understand why we think of integration and why it's such an important word within the process of both structural dissociation as a theory and in the therapeutic settings within which we work. So I hope this has been great for you. There's a lot to take in. Please do keep liking, subscribing, sharing the video as much as you want to do. It's really kind of people to do that. Leave the comments in the sections below. As always, we read them and take note of them. So between now and the next video, please do take great care.